But if you do find an abnormal PTT there, and you really should have a framework for thinking about this. So we made an infographic because he gave us a bunch of conditions that you should think about, either if they're non-bleeding or if they're bleeding. So for the non-bleeders with a prolonged PTT, the top thing you should think about is antiphospholipid antibody syndrome, because more times than not, those patients are clotting. They could have arterial or venous clots, and you might ask about miscarriages, like pregnancy losses. That might key you in that, hey, this person could have antiphospholipid antibody syndrome as with the lupus anticoagulant. Other things on that side for non-bleeding prolonged PTT would be hemophilia C. Oftentimes those people won't have any clinical bleeding. And then there's this contact pathway that he talked about. It's a pathway that involves prekallikrein, kallikrein, and not something I really remembered at all from medical school, but he said that's one. So I'm going to be letting them figure that out on a referral. I'm not
Yep.
going to figure that one out. But the other thing you just don't want to miss is like heparin or heparin derivatives causing the prolonged PTT. Like if they've been exposed to heparin, that's a silly thing to miss. And you don't want to make a big workup for no reason.
For someone on a heparin drip, yeah,
Yeah.
great point.
So Paul, what about on the bleeder side of the graphic? What about that?
Yeah, so the patients who we kept using the term bleeders and non-bleeders, which felt very sort of non-patient centered. I'm not sure that patients who bleed is much better, but in any case, with what there is bleeding and elevated PTT, the things that you want to think about are your hemophilias, which are caused by factor deficiency. So hemophilia A is factor 8, B is factor 9, C is factor 11. Again, once I'm starting to think about those, hopefully a hematologist is already deeply involved in the mix. Factor 8 can also be affected by an inhibitor, so you can think about things like CLL or postpartum stuff. Von Willebrand disease is also elevated PTT, and that's someone who would have a bleeding tendency, and the reason being is von Willebrand actually, I think, protects factor 8 is the way he described it, so in the absence of that, then you're more prone to bleeding. We talked a lot about von Willebrand factor. And then medications would also, again, as we talked about before, so things like heparin would certainly cause bleeding and would also cause elevation of the PTT as well.
Yeah, so thinking through the workup is something that you should do if you find this prolonged PTT. The most common cause of somebody that's bleeding, or at least the most common inheritable bleeding disorder, is von Willebrand disease. So you should know at least a little bit about that. And this von Willebrand factor, I always have to refresh myself on this because maybe I'm missing a bunch of cases of this, but I do think about it, especially when someone has like heavy menstrual bleeding and they're coming in. I'll ask about this history, but it's a glycoprotein, helps with hemostasis, platelet adhesion to sites of vascular injury, and then it's a carrier for factor 8. So it helps helps in clot formation essentially. And you can have either a quantitative, you're not making enough, or a qualitative where it's not working, von Willebrand factor deficiency. And that can be diagnosed by checking like a bunch of different studies. He mentioned them. So there's the von Willebrand factor antigen. There's these activity assays like the risk-to-seeding cofactor activity. There's factor 8 activity that you can check. And then he says he would also sometimes check multimers. I think it's totally reasonable if you want to like look this up and try to order it yourself, or if you just want to refer on to hematology for this kind of workup. I guess it would just depend on kind of your practice pattern and where you live. But this is one that I think you will find some cases if you're looking for them and being thoughtful, and maybe now having a better framework for approaching this bleeding, I may also find more cases.